Welcome to my channel. If you're a new parent, then you need to know the truth about baby hiccups. It's something almost every parent notices, and it can be a little surprising the first time you see your tiny newborn suddenly start hiccuping. But don't worry, hiccups are a completely normal part of a baby's early life, and they're actually more common than you might think. Babies get hiccups a lot. It's totally normal. In fact, most babies will experience hiccups several times a day, especially in their first few months. These little spasms can happen whether your baby is awake, feeding, or even sleeping peacefully. Tiny hiccups are just spasms of their diaphragm muscle. The diaphragm is a thin, dome-shaped muscle that sits right below the lungs and plays a big role in helping us breathe. When it contracts suddenly, it causes that familiar hic sound. This muscle sits under their lungs and helps them breathe. For newborns, the diaphragm is still developing and learning how to work smoothly, so it's not unusual for it to be a bit overactive at times. Newborns are still learning to control their diaphragm and, well, it can be a bit jumpy. Sometimes things like feeding too quickly, swallowing air, or even a sudden change in temperature can set off a round of hiccups. Overfeeding, swallowing air, or even a change in temperature can trigger these little spasms. You might notice hiccups after a feeding session, or when your baby gets excited or startled. Although they might seem uncomfortable to us, hiccups don't usually bother babies. Most of the time, your little one will keep right on sleeping, feeding, or playing as if nothing is happening at all. They can even hiccup in the womb. Many expectant mothers feel these gentle, rhythmic movements before their baby is even born, which is just another sign of healthy development. Rest assured, it's all part of their development. Hiccups are a natural part of growing up, and as your baby gets older, you'll likely notice them happening less often. So next time you see those tiny hiccups, just remember it's a sign your baby is learning and growing every day. Old wives' tales about baby hiccups abound. You might hear that hiccups mean your baby is cold, or that they need sugar water. Don't believe everything you hear. Hiccups are rarely a sign of something serious. Wrapping your baby in another blanket if they have hiccups won't hurt, but it likely won't help stop the hiccups. And giving sugar water is not recommended, especially for infants. Most hiccups in babies are completely harmless and usually go away on their own within just a few minutes. It's a common occurrence, especially in newborns and young infants, and is rarely a cause for concern. Hiccups are simply tiny spasms of the diaphragm, and they don't bother your baby as much as you might think. However, if you notice your little one seems uncomfortable or you'd like to help ease their hiccups, there are a few gentle techniques you can try at home to soothe them and make feeding time more comfortable. One of the most effective ways is to try burping your baby during and after feeds. This helps release any trapped air bubbles in their tummy, which can sometimes trigger hiccups. Another helpful tip is to hold your baby upright for about 15 to 20 minutes after feeding. Keeping them in this position allows gravity to help settle their stomach and can reduce the chances of hiccups returning. Sometimes, simply adjusting your baby's feeding position can make a big difference. Try to keep your baby's head higher than their stomach and make sure they're latching or sucking comfortably to reduce the amount of air they swallow. If you're bottle feeding, consider pacing the feeds by giving your baby small breaks. Feeding slowly and allowing pauses can help prevent your baby from gulping too much air. Pause every few minutes to gently burp your little one, especially during longer feeding sessions. This can help keep them comfortable and reduce the frequency of hiccups. And if you're breastfeeding, make sure your baby has a good latch. A proper latch helps minimize the amount of air your baby swallows, which can go a long way in preventing those pesky hiccups from starting in the first place. Although hiccups are common and usually harmless in babies, it's natural for parents to wonder when they might signal something more. Most of the time, hiccups are just a normal part of your baby's development and nothing to worry about. Babies often get hiccups after feeding or even during play, and they typically go away on their own. However, in rare cases, frequent or severe hiccups can be a sign of an underlying issue that may need attention. It's important to pay attention to your baby's overall behavior and any other symptoms that might appear alongside the hiccups. If your baby's hiccups are happening very often, seem to last for a long time, like more than an hour, or if they seem to make feeding or sleeping difficult, it's a good idea to take note. Persistent hiccups that disrupt your baby's ability to eat or rest comfortably could be a sign that something else is going on. In these situations, it's best to talk to your pediatrician. They can help you figure out if there's a reason for concern, or simply reassure you that everything is normal. Sometimes, hiccups that are accompanied by frequent spitting up, excessive fussiness, or discomfort after feeding may be linked to reflux or another digestive issue. These symptoms can sometimes be subtle, so it's helpful to keep track of when they occur and how often. Reflux is fairly common in infants, and your doctor can suggest ways to help manage it, such as keeping your baby upright after meals or adjusting feeding routines. Your doctor can help determine the cause of your baby's hiccups and recommend the best course of action, whether it's simple reassurance or a specific treatment plan. Remember, as a parent, you know your baby best. Trust your observations and don't be afraid to ask questions or seek help if something doesn't feel right. Trust your instincts and don't hesitate to reach out to a healthcare professional if you have any concerns about your baby's health or well-being. Your peace of mind is important, and your baby's doctor is there to support you every step of the way. If you found this video helpful, please like, share, and subscribe for more tips on caring for your little one. Your support helps us create more content to guide you on your parenting journey. Thank you for watching.